Hey guys, Dr. G here with Late Nights with Dr. G. You have questions, I have answers. On this episode, and this is episode 5, we're going to kind of hit on what's going on with these peptides. What are they? Are they going to help us? Are they doing anything? How does that affect, our metabolism? And then also, what about your hormones? The type of, specifically for men, the testosterone. What do you need to do for that? We're going to touch up on that as well. Additionally, why are you listening to Dr. G? I'm going to tell you a little bit about myself so you kind of know where I'm coming from. And I actually do have some education in what I say. And so you need to listen to me. Additionally, in this episode, we talked about methylation testing and blood tests and the type of testing that you need to get for pretty much anything, especially if you're just starting out on your journey of being in better health. Additionally, the GLPs, we talked about that. That kind of goes hand in hand with a lot of these peptides that we talked about. But I really kind of focused on these essential amino acids that can really help you get the results that you want without losing all the muscle. Another aspect of what we will look at in this episode is the future of medicine. What are we evolving into? Okay, we know that we have a lot of different synthetic medications out there. At least in my opinion, we want to focus on stem cells, peptides, AI, everything that's going to really allow us to treat an individual and as holistic as we possibly can. Hey guys, I'm Dr. George Armandaris.
So Dr. G, what are your qualifications? I know you're a doctor, but can you tell us some more about your qualifications, what your background is, and the nature of medicine that you study?
Okay. Classically, I was trained in anesthesia and general surgery. With that, I did additional training with regenerative medicine as well as pain management, both on the acute pain service as well as the chronic pain service. And then eventually, when I went into private practice, I did private practice anesthesia, but I also did private practice pain management. And there we do all the injections that a lot of people know about, as well as a lot of the spinal cord stimulators, pain pumps, kyphoplasties, which are essentially you're putting cement in various vertebral bodies in the spine to stabilize them if they've had pathological fractures. Along the way, I did additional training because it was kind of close to my heart, was in regenerative medicine. Now that's how we've talked before about how I have I had a congenital bicuspid valve, which was just a valve that didn't work properly in my heart. And so subsequently I had to have heart surgery and have a mechanical valve. Now they have been doing this for quite some time. And so hopefully over the next 10, 20 years or so, when I do need another valve, because unfortunately the mechanical valves, although they say they last forever, they do not last forever. And so I will need another valve. I would like to utilize a valve, specifically a cadaveric valve with my own stem cells or my own DNA. So that can be essentially transplanted into me, and I can have what's called a native valve. And so specifically, my certifications are in pain management, anesthesiology, and regenerative medicine. With those three kind of specialties, it's allowed me to do, or I have the potential to do pretty much any type of medical treatment with patients as it has to do with anything for pain or regenerative medicine. Now, the anesthesiology is just mainly pharmacology and clinical physiology, and so we kind of know that quite well. So those certifications are important. So when I tell people something, I kind of know what I'm talking about for the most part. And additionally, I should say, I do have something very unique that literally I don't think any individual doctor, like none in the United States, have. And I have what's called it's one of my DEA licenses. Every doctor has a 222, which is a standard DEA license, so that you can prescribe narcotics or scheduled drugs. I have a 225 as well as a 222, which allows me to distribute and purchase in large quantities and distribute those out to various, I can sell them, I can utilize them in surgery centers, hospitals, wherever, even in the office setting. And so I did that just because I own an office-based anesthesia company. And so with that, you have to go to all these different places at different locations. And if you do that and you carry narcotics, if you don't have a 225, that's considered trafficking, which is a problem, especially when you're doing medicine and if you live in the United States. And so that's one reason why I got that particular license probably close to 15 years ago. Now you cannot get them. An individual doctor cannot get them. Those are the same kind of licenses that a place like Costco, Walgreens, those kind of places.
Is that different than like a traditional doctor that has like for those licensing? Or?
Well, you won't. Well, now no individual doctor can get it. And I was kind of like, let's say, grandfathered in because I got it.
Why can't they get it anymore?
Well, because the federal government or the Drug Enforcement Agency felt that only larger companies should be able to utilize a distribution license like that to distribute narcotics or scheduled drugs. Not all.
So you're one of the last legal drug dealers.
Yeah. Well, I can't say that, but for in all practical terms, maybe. but yeah, it's kind of crazy. And now as an individual physician, you can't get those. They've outlawed it. But because I've had this for so many years, I'm kind of grandfathered in. They can't just take it away from me unless I do something wrong.
What are the benefits of that? Or like, how does it make you unique? Like, does it give you any special ability to?
Well, the cool thing about it is that I can purchase scheduled drugs, not just narcotics, just say scheduled drugs. There's a variety of different scheduled drugs in larger quantities, or I can buy them equivalent to, let's say, a surgery center or even a small hospital. Now, granted, they're always going to give a larger hospital clearance before me, but I'm pretty much up there. So a lot of friends of mine that do medical missions, as an example, and I used to do a lot more medical missions about 5 or 6 years ago. Well, you have to get certain narcotics to provide the treatments or whatever you're doing in these other countries. And so because it's a federal, backed license, I can do that. And,
so are you on like lists? Are you on lists?
Yeah, which is kind of crazy. Yeah. Well, it's a list in a sense that my company is on the list. I'm not individually, but I'm the only doctor that it's under that has that DEA. And so it's pretty interesting. And, some of the stuff that I can do, if I would want to,
like can you get people more experimental treatment? Like maybe they normally
possibly get? Now with the new administration that we have now, you don't really have to go through all of the
red tape.
Yeah. The red tape that you had to in the past. They allow you to, you have to have some things there that will show that person deserves or needs that particular thing that you're looking for. But yeah, I can kind of move things through everything a lot faster without so much red tape. So that makes it kind of interesting.
Is there any like use cases that you've used it, or use it mainly for the mission stuff?
No, I've mainly only used it. I used it for my, so that I can transfer certain scheduled drugs. And we used to have, so many different individual offices that we'd go to, plus into Colorado, because we were the largest mobile anesthesia company there. And so I would be able to take narcotics as well as any scheduled drug. But usually for what we're doing, it's always a narcotic that we deal with. And so it's interesting, it helps me a lot to kind of understand what is needed in a larger setting, much like a hospital or a surgery center or something like that.
Yeah.
And so the nice thing about having that is that there is no limitation on what I can do. Now, granted, I have to ask the different entities or agencies that govern those depending on what I want to do, but I can do it a lot easier than pretty much anybody else can do it, unless they're let's say a research company or a university or something like that.
Yeah. So when it comes to talking about experimental therapy, stem cells, we also we talked recently at your office about peptides. Mm-hmm. Can you go into a little bit about how you were talking about how the future of medicine is going to be just peptides. It's just going to be 3 or 4 things you said it was going to be.
You know,
with AI and therapy, gene therapy.
Once AI gets utilized on a more daily basis, right now, you know, we do use it with ChatGPT and Gronk and all these other apps that are out there. But I mean, it can do so much more by way of the biometrics and just allowing us to figure out certain protocols that would take us forever to kind of figure out. With an AI component to it, it allows us to kind of get all the data, or I should say it gets all the data, evaluates it, and places it in a format that we can understand, and we can form protocols a lot faster. And so that's amazing. And so in my opinion, I feel that medicine is going to change in the sense that, you know, you see a lot of these synthetic drugs that we use to treat, you know, cancers and other, you know, very specific diseases, neurological diseases and things of that nature. But it's all going to be based on gene therapy, stem cells and exosomes, and peptides. Peptides, the one peptide that everybody knows, but we don't really talk about it, is growth hormone.
Yeah.
That's 192 subunit peptide. And it's a very large peptide, obviously. And, you know, it does a lot of good things, but if done incorrectly, it can cause a lot of bad things, you know, cancer being one of them, and as well as just a lot of issues within, you know, affects the liver, affects the kidneys, affects the brain. It does a lot of good things, but it can do a lot of bad things if you take it not like you're supposed to, and under a doctor's supervision. And so these individual peptides are usually 1 to 3 single unit peptides. Now, some of them have 2 and 3 little units on them, but they're very, very small, very, very easy. They're easy to use, virtually no side effects. Now, some of them have side effects if you use them more often, like the main one that everybody knows is the GLP. Okay, it's a glucagon-like. The GLP stands for glucagon-like peptide, and that specific peptide acts like glucagon. Well, so what's the big deal of it acting like glucagon? Well, insulin and glucagon compete with each other. So when insulin is low, glucagon is high. When glucagon is low, insulin is high. You do not want your insulin high. The more you have your insulin high, the more your fat is not utilized for energy, it's utilized for storage. A lot of people think, oh, what's insulin do? Oh, it brings down your blood sugar. No, it blocks your ability to utilize any other energy potential in your body. Sugar, you'll use a little bit in what that's left in your liver. That'll take about 20 minutes, glycogen, and then it's going to store all the fat. It'll block that. So the more insulin you have floating around, the more fat you're just going to store. You're not going to utilize it for energy.
So so type 1 and type 2 diabetes, one is too low and one is too...
No, a type 1 that's a genetic variant where your pancreas lacks the cells to produce insulin. So it just doesn't work. You're born with it. Once again, that's a genetic disposition that, in fact, I think it was in Japan or one of the Asian countries, I believe. It may have been China, but I thought it was in Japan or Korea. But they were able to reverse that with gene therapy. So a person that was born, like they're born with it, they have to take insulin shots.
But this is not this is not common practice.
No, it's not common practice right now, but we can do it. We can do it. I mean, it should be common practice, but it's not. I think it will get easier as now that we have that CRISPR. CRISPR is a gene modulating type therapy that you can move certain genes or turn off or turn on certain genes, which will either inhibit the ability of the body to make a certain, let's say, enzyme that, or lack thereof, that causes some type of neurological disease or some type of fat metabolism disease, whatever. There's some very, very specific diseases that there are no cures for. Gene therapy will be able to cure them. Now, we've been able to do that for a long time. Now, the CRISPR's only been around for maybe 15 years or something like that, but it just keeps getting better and better. And then with you add AI to that it can, we've already mapped the human genome. And so now, man, it can just in a very quick amount of time can tell us what we need to do, which genes we need to stimulate, which genes we have to remove to get the thing that we want to help whatever it is that the person is lacking or not having. It just depends. But that's why I think that as medicine continues to evolve, it's going to be mainly peptides, very specific peptides. We now have all these different GLPs. Well, we have a BPC-157. That's for a repair.
That's what you told me that I should.
That's the one that I think, because BPC-157, there's an oral component and then there's also an injectable. Both, it's very stable. The oral component really helps anybody that has anything dealing with their gut. I mean, whether you have ulcers, whether you have just overactive stomach where you have a lot of acid production is causing you a lot of problems, leaky gut.
What happened? What about like people who have IBS type stuff?
Same thing. IBS is lower on the. It's not in the stomach. It's like in the colon or in small bowel, depending on where you have it. That too can help that. Now it's a little bit harder to do that with the oral, because the oral BPC, once you take it, it kind of stays in your body, it stays in your gut, specifically in your stomach. And so to get to somebody with IBS, it's going to be a little bit more difficult to do. That being said, I think that other peptides, certain GLPs and other specific peptides for colitis or irritable bowel syndrome can help that to a greater extent than even BP-157.
So there was something pretty interesting actually. There's a couple of natural influencers, one particular that I know I'm friends with, and he said people talk about peptides and all of these peptide therapy, etc. And he said that there's nothing better for the body than nature and what nature has. And I know there's some truth to things, but like, where do you see that this is and this isn't from a fundamental mental naturalist point of view
Mm-hmm.
to someone who is a proponent of peptides and peptide usage? Where do you stand in that? I know you were for it, but what's your point of view on the holistic point for that?
Well, this is the thing. Everything should be started with a whole food diet, drinking enough water, getting enough exercise, the stuff, getting enough sunlight, the stuff that you can do that doesn't really cost any money. Now, the whole food diet, unfortunately, is, because that means organic. That means, food that, sad to say, that is grown, let's say, at a farmer's market. It's going to be more expensive than the food that's totally bad for you.
Yeah, so cheap in every other country, just expensive here.
It's crazy.
But around the world, it's so cheap.
So that's that's why I'm hoping that the MAHA with this administration, the Make America Healthy Again, I hope that they can kind of change that.
Maybe like subsidize health.
Exactly. Obviously, they're not going to pay for it, nor are we asking for that.
But if they
definitely can subsidize
for the American public.
Yep, absolutely.
Even at 20%,
whatever they can do, just mainly because we have to improve our diets. It's like the whole United States, we're just a people of inflammation. We're just inflamed, and a lot of it's dealing with the food that we eat, even the water that we drink, or if we're not drinking water, the other stuff that we're drinking that's not good.
So what at what point though does it go from, I would consider peptides? Like you sounded super passionate about this BPC.
Yeah.
It's an amazing peptide.
The main reason why, because it allows your body naturally. Now, the peptide's not natural. It's a synthetic drug or a compounded drug, So yeah, it's not natural. It's based on a natural component, but it's not natural. It's all synthetic. It allows your body to heal itself. BPC in and itself is not going to heal you. What it does is it allows your body or your immune system to work like it's supposed to. Mm. And so it stimulates certain things, it inhibits other things so that your body can repair itself. So in that sense, it is a natural component. So everybody says, we just got to eat clean and drink clean water and make sure that you
But if your body has certain processing incapabilities,
but a lot of times, a lot of that is just because you're eating bad food, or you're doing, you're staying up late, or your circadian biorhythms are off, or you're not sleeping enough. I mean, all of that Yeah, true that those natural things are going to make you better. But this is why medicine, or specifically Western medicine, this is why I think it's good. It's bad too, but it's also good because it enables us to use certain synthetics that can truly activate aspects of our own body to work better, to do whatever you need it to do, whether that's
and also
repair
too,
or,
maybe if there's a time of the essence type of issue.
yeah, I mean that too. It can speed things up, So I'm not really big on that. Now, granted, I see a lot of these natural. Now, I'm not going to call them natural path people, but they're just people that are very holistic and natural in the way they treat, things that may happen to them and their family. That's a great way of living. It really is. If more of us lived like that, the $1 trillion that we spend on, and I do say $1 trillion, it's probably not quite $1 trillion, but it's pretty much close to that, is what we spend on healthcare in just this country. I'm not talking about any other country.
Yeah.
And it's kind of sad, and it's mostly people, when you're paying for insurance, as an example, the insurance that you pay, you say, well, I never use my insurance. I barely get sick. I don't go to, unless you have like an accident or, God forbid you get cancer. But that's not the most people within. Most people insurance is what insurance is paying for are the people that are probably 90%, 95% that are so sick, and that's where all those dollars go, and if we cleaned up our diets and cleaned up what we, these bad habits and drink more water and got out in the sun more and, lifted weights.
Except for in Arizona, I don't know if we need to be in the sun.
Okay, within reason, only for 30 minutes to an hour at the most. But, all of that is that's good for us, and we do need to change our habits so that the medications that are out there that can help or work better, I should say, and that's the real key to it. So somebody that says, well, I want to be holistic, you are being holistic if you can take care of your body. And if you need a little nudge or a little help with some of the more synthetic treatments that we have, then, so be it. But I would much rather utilize a peptide or stem cells. And stem cells, by the way, that is natural. That's not, I'm not, even if we culture and grow them, we're growing normal stem cells. Now in this country, we can do that. I can harvest it either from your bone marrow or your adipose, and they will clean it and culture it and grow your own stem cells that you can use. And, and that's important, but that's natural. That's not a synthetic, It's not a synthetic stem cell, know. They may have that in the future, but for the most part, that that is we don't have that right now, and so I think there has to be a combination of holistic treatments as well as true Western medicine with the type of medications that we use. I'm not a big proponent of, you see all these, you remember the jingle of the Skyrizi and Jardiance and, all these songs that people are singing, like I had said before, it's us in another country, and I don't know which is the other country, that we allow, the government allows them to market that, the pharma companies. No other countries allow that.
Yeah.
And so it's just kind of crazy. But those kind of medications, although they may have helped certain people, I do think that some of those synthetic medications, even as a physician,
it's like a last case.
You have to really evaluate those and make sure that that's going to be the best thing for you, depending on whatever's wrong with you, and so that's, there are a lot of ways to, like, in anesthesia, there's a lot of ways to, stabilize somebody. There really is. There's a lot of ways to intubate somebody, but the best way is the way that you can do it quickest, safest, and the best way to stabilize the patient, So when they say, oh, this is the best way to do it, or this is the best way, there's a lot of ways to treat things. You just have to make sure that that's going to be working for you if it's, your body that you're talking about.
Okay. So, I want to also go into, we were talking about men's health.
Mm-hmm.
Men's hormones, testosterone, free testosterone. Can you go a little bit into how that applies in your practice and how you guys take care of men's health, and all of that?
When we talk about different peptides and all this stuff like that, The first thing you need to do is do a proper history and physical on a particular patient, so you can learn, what's going on with them, what problems they're having, and see if there's any type of physical issues that you can kind of see just by doing a simple physical examination. The second thing is lab work. Lab work is crucial, especially when you're
Talked
talking
about the methylation tests.
well, that's one aspect. Initially, just good old fashioned blood work to see where your blood is. What's your hemoglobin? What's your hematocrit? What's your potassium? What's your iron? Just the basic stuff that we look at to see if you're just a healthy person. If do you have an anemia? Is it a macrocytic or a microcytic anemia? There's a lot of things. Are you deficient in B12? Are you deficient in anything? And this is where you mentioned methylation. This is where that comes in. The cool thing about methylation, it's not like blood work. You have to get it done every 3-6 months or whatever, depending on let's say if I put you on testosterone, initially probably every 3 months I would get blood work, and then after you kind of stabilize and get into a habit of how much you take and stuff, then maybe we can do it every 6 months. But you just have to do it multiple times a year is my point. With a methylation test, you do it one time. It is specific to you. It is essentially a gene test that figures out what you're deficient in. And it's specific just for you. We take all these supplements because we watch them on TV or we hear about them on social media and we're like, wow, this is great stuff. You may be taking this and you don't need it, which most of the time you'll just pee it out and no harm, no foul. But other times is you're taking more of something that you don't need. You could affect yourself to where you would have problems.
Yeah,
you just don't know. But you don't know. You don't know what's causing it. And it's simple, like you're taking this, and I'm not saying a multivitamin, I'm taking more specific supplements that can affect you. So you have to be very careful with that. And so I see all these biohackers and all these people that are not physicians that are telling you all this stuff. Now, for the most part, yeah, what they're saying is true and it's good stuff, but you have to understand that unfortunately most people aren't like them. They're like super healthy and can afford to get all this organic food and red light therapy and cold plunge and all this other stuff. And it's nice if you can get those, but the reality is that a lot of people can't afford to get all that stuff, So, and additionally, a lot of people are on some type of medication and maybe 2 or 3 different medications. And so those nice things they're scrolling through social media and they see these, oh man, I want to do that. Yeah. I want to get, not knowing that it could,
counteract the medicine.
Counteract the medicine they're, taking or make it stronger, and cause them some problems, You have to take everything with a grain of salt. Do I like what I hear on social media from these health coaches and biohackers and others? Absolutely, because a lot of them have some really cool stuff. I just want people to be smart in the sense that you do need to talk with your physician or whoever you trust that is a physician of some sort, so that you can make sure that what you're doing is at least okay for you individually. And so that's the only thing that I have issues with. That a lot of people listen to these people and they're great, but you just have to make sure that what you're doing is not going to affect you.
Who are some of your favorite people to listen to?
Oh, Gary Brecka. He's wonderful. And I like it because he's very, he has a big research team that finds all this stuff out, and he does some very good, informative type of, his podcasts and then certain, webinars and things of that nature. And then just posts that he has. What he is telling us is actual things that people can do. And he always says, look, I'm not a doctor, so you need to check with your doctor. And I appreciate him saying that, because you always have to check with your doctor, because people aren't so healthy. Some people are, but a lot of people are not. They're on different drugs for whatever the reason. And so you need to check that out. So I really do like what he has to say. Was it Paul Saldino? He actually is a doctor that, and he knows it, but sometimes, all the things, he goes, don't do this, don't do that. And I'm like, well, hell, man, you can't live. I'm like, well, shit, what am I going to do? My sheets aren't working. I'm getting too much electricity from the TV, or the Wi-Fi needs to be cut off. There's so many things. And so you got to take everything with a grain of salt. What they're saying is that, it's true and it's real, and yeah, he'll throw out research articles that say this and that, and they're true. Absolutely. But it has to be realistic to people, if that's the case, it would be, it would be hard to do every little thing to make sure you're not getting microplastics and you're not, you just want to do as best you can and, at least develop a habit so you can have the least amount of potential of getting microplastics or excess electricity in your system, and so there's a lot of things. I think a lot of people are, kind of reaching out or listening to them and following them because they're sick and tired of being sick and tired, meaning they don't trust the
traditional
medicine anymore. And that's kind of sad. And a lot of people want to blame doctors. I'm sure some of them, probably do things like they're not supposed to. But for the most part, every doctor, at least the ones that I know, they want to help people as much as they possibly can. Now, do we become jaded over time? Yeah. And why? Is because, man, the insurance industry, it really
I've never heard anything good about the insurance industry.
And it's sad. It's sad. And because it started out as something that we needed, and it was good. It really was. But now,
do you think that the Obamacare, like in that era, did it help anything?
No.
Did it make it worse?
Did it help some people? Yeah, it's always going to help some people.
Yeah.
But you have to see what it does to individuals, what it does to the economy, what it does to
medical system.
The system. I mean, is it going to raise rates? It's going to lower rates. What's going to happen? What is it going to do? And a lot of that stuff, affects, one thing affects another, which affects another. And so, it's hard. I'm not saying that I have the answer. I just can say as a physician, I don't think it's as good. And it needs to be worked on. Everybody says they're going to work on it. Every administration says that, and nothing ever gets done. Yeah. But I think that's unfortunately the issue with politics.
Do you think there's going to be a change here soon? I know you talk about this current administration, but what do you actually see happening?
I don't know. Seeing what they're trying to do with the vaccines and seeing what they're trying to do with our food supply and getting certain components of the diet to or individual components that can cause cancer, getting them out of the food supply. I think that's a great first step, but it just is going to remain to be seen, because every other administration, whether it's Republican or Democrat, it doesn't really matter. They always say they're going to do something. And unfortunately, we are left, by we, I mean the American public are left with, well, I thought we were going to do this, or I thought this was, and will some people get benefit? Yeah, some people will benefit, and that's good. But unfortunately, a lot of people will not. So it just remains to be seen. And we just got to see what's going to be allowed. The problem I have with Congress is that it's a tit for tat. Nothing really gets done. You'll have a bill that
I'll have to tell you after, but I might be interviewing a very prominent lawyer that works with some of the people who deal with the vaccine stuff.
Oh, wow. And that's interesting. That's only one aspect. There's which I think are some other more important. The vaccine, don't get me wrong, those are important. But there's so many things that are important right now that need to get at least rectified in some way, and so it just remains to be seen, and I'm in private practice. I don't, work for a government, I don't work for the VA or work for a big university. Maybe as I want to slow down, I might do something like that. But I'm just, from my perspective, looking at that, I do have to say, when I was in medical school and when I finished medical school and finished residency and I found out I had this issue with my heart, the insurance paid for everything, and it was great. I mean, I did have to pay. Ironically, what I did pay for, the anesthesiologist, which I'm like, what the hell, man? But that being said, everything was covered. And so that was good. But then again, I also worked. I was in the Texas Medical Center, and so we were covered, because we were previous residents, and I was still, although I was an attending I still had that particular insurance. And so, yeah, I covered everything. And so that part was awesome. But unfortunately, I know that's not always the case.
And if somebody does have something like that and it's not whatever gets covered by typical insurance, but they're still on the hook for how much?
Man, if the insurance, even let's say 100%, and the insurance says, oh, well, we'll cover 70%. You're like, oh, that's great, 70%. That 30%, if it's something really, really,
it's like a $300,000.
Yeah, you can do the math on that, and that's hard.
So you could owe 50 to 100,000.
Yeah, that's very hard for people.
And to pay that. So does it? I mean, is it just like, okay, it's on your record, and if you don't pay it, you're just gonna screw your credit? Or how does it?
Now, this is the thing. The Biden administration, they kind of, and I think they did this to a lesser extent with the Obama administration and the first Trump administration. I think they didn't allow debt collectors to affect people's credit. And so now it's a little bit more specific, because with the Biden administration, they said, no, we're not going to have that affect somebody's credit. Now, they'll still put it on your credit, but it's going to be seen as if you can't pay it, as an example. Because, if you do that and the person says, oh, you owe $50,000, a lot of people can't pay that. Maybe it was they got in a car wreck and it was, you had to get treated. And so I don't particularly think that's fair. And so that administration, when that was implemented through Congress, I think that aspect was good, And I didn't think the Biden administration did that much, but that part I did think that was the.
If that's the case, then do you think that would be something that everybody would do on purpose in order to avoid paying? Like
they could because they know that I mean, everybody should pay their bills. That's just
pay their bills, but when your bill is 700 times marked up,
Yeah, and I always tell everybody that when you go, even if something simple, always ask for an itemized receipt or invoice of what you paid for or what they're charging you at any hospital. I guarantee you they'll give you a number, and almost immediately, without you doing anything or them doing anything, they'll take 30% off. And then if you really get in there and because they charge you for things that are just ridiculous.
Yeah, don't they charge like an IV, and then they'll charge like $800 for an IV?
Yeah, I mean, it's crazy.
$1,000.
And if you don't pick that up, because that's what they're used to charging the insurance companies.
Wait, so you're saying that everybody, so if you're paying and you want to get your medical bill down, you ask for an item?
Always. Even if you have insurance, even if you have amazing insurance, you always ask, let me see that bill. And you go through it with a fine-tooth comb, because the thing about it is, even if your insurance agrees to pay it and you really don't have to do anything, it's going to affect somebody else. I'm telling you, it's going to affect somebody else, because the insurance says, well, shoot, we paid, $100,000 for your treatment. They'll just increase rates on people that maybe, let's say they're both Blue Cross or they're both UHC, but you just have a better plan, because of who you work for. Or
isn't that illegal though, to switch rates from one person to the other?
That is illegal, and it's not that they're switching.
You're saying they do it, or
well, it's not that they do that. No, they don't. For an individual person,
or do they have like codes to get away with?
Well, code. That's a whole other. We can do a whole show on codes.
Yeah,
but no, in a particular regional area, like the rates that you pay in LA are different than the rates you pay in Abilene, Texas, where I'm from, because it's 120, 140,000 people, whereas you have, I don't know how many million are in LA. It's different, and it's different that what's covered in a small little West Texas town versus what's covered in a liberal, huge city in California. And so, their rates are different, and so it's just,
so the hospital you choose as well.
Yeah.
And if you're in network, I mean,
that's the thing. Are you in network with that hospital? Because if you're not,
how do you get a network that's in the network that has a cheaper hospital?
Yeah, exactly. And you just don't know.
Yeah.
Because you have to, once you get an insurance, you have to kind of.
It kind of sounds like they're just trying to win a war of attrition against people.
I don't know.
By just making you so tired
that's what-
chasing everything that you just give up.
Yeah, and that's what ends up happening is people give up.
There was a South Park episode on that. They were,
I know, it's sad to say.
navigating the system. And they made a song and they had to run to one doctor and then they said they have to go to this doctor and that and this and that. Then they have to get this approved. And it basically was a song, like a 2-minute. And then they're like, we haven't gotten anything done.
You know, the thing is, I don't, you maybe don't remember this, but when it's in the late 70s, early 80s, you know, they would have the, cause then that's when we only had like 7 channels. Even cable only had like 30.
I was before my time.
I mean, and there was this, they'd always have on Saturday morning cartoons, they'd have this, I'm just a bill, I'm only a bill. Up here in Capitol Hill.
Yeah. I've seen that.
And you know, it's to help kids, you know, understand the bill. Well, they were basing that on that song. It's kind of funny because I saw that episode on South Park. But anyway, it's sad to do that. We have to make fun of it. To kind of,
they make fun of a lot of things that I feel like are really relevant to, you know,
and that's good. It puts a, you know,
they needed to. I mean, like they were talking.
It makes it funny, but
did you see the Ozempic one? They were saying you could take Ozempic or you could take Lizzo.
Oh man,
it's the Lizzo's the singer, right? I think she went on Ozempic though.
Yeah,
she lost a bunch of weight.
If you see everybody, all these famous singers and actors, they did. And they're trying to say, oh, you know,
But you said there was something you could take. If you're on Ozempic, there's something you could take that's really important.
Yep.
That helps you maintain muscle. And if you took it, all these people wouldn't be dealing with this problem with Ozempic. Yeah. What is that?
And that is, it's EAAs, essential amino acids. But, you know, people go, oh, there's a bunch of essential amino acids. Well, a lot of the amino acids, probably the majority of them, probably 70 or 80% of them, they're not that good. They're more, I shouldn't say they're more fillers, but they only have an absorption rate of maybe 70%, and that's pushing it. You know, some of them usually are around 40 or 50%. Okay, so that just means you pee it out, you know, or your liver or kidneys detoxify. Your liver
like even the amino acids you're buying at the store, like
there's a particular brand, and Gary Brecka pushes this, and this is why I got kind of researched this. Is Perfect Aminos. Perfect Aminos is the brand. It's by bodyhealth.com, which is kind of interesting. And I'm not, you know, they're not paying me or anything like that. It's just, this is the one that I like. Now, there is another particular brand. It's called Optimize Aminos, and they're almost identical to the aminos, the Perfect Aminos. And they are 99% metabolized and absorbed.
So you're saying the best brand is
that one right now?
Perfect
I mean,
Aminos?
trust me, it's not cheap. They are expensive, but man, they work well. If somebody that's on any type of GLP, they were to take these, you know, you'd have to take a lot. Don't get me wrong. You take 5 in the morning, 5 in the afternoon, 5 in the evening. If you take those, you will not lose the amount of muscle that you lose and have the skin laxity. The face, especially in the face, in the butt area. I mean, it's amazing. I mean, you know, I also do a lot of cosmetic type treatments, liposuction being one of them and skin tightening being another. And so we see that all the time. Now, I don't do
You treat patients also that have been on GLPs?
Oh, I assume people that come in that have a little bit of skin laxity, or you can tell that they say, oh, I lost a lot of weight, or I lost 40 pounds. Or
nowadays it's just so
I'm
common.
like, it's because you're probably on a GLP. Whether you tell me or not, most of them do, but not all of them tell me. And you can just tell. There are telltale signs of people being on a GLP.
Because you lose weight so rapidly, right?
Yeah. And, you know, GLPs, those were originally made. They've been around forever. A lot of people, they just, you know, now over the last 3 or 4 years, they're trending and it's so big. But man, they've been around for decades. And the thing about it is mainly for people that are morbidly obese, or people that are
like diabetes,
type 1 or type 2 diabetics that are overweight. Yeah. And that's what it's made for. And for the longest time, I was very like, man, I can't believe these people are just doing it just to lose, you know, 10 pounds, 15 pounds. And then they're like, oh man, if I can lose 15, I can lose 30, you know, and now you're pushing it because you don't really need to lose 30, you know, and, but they like the way they look, but yeah, their skin is not going to catch up. And so if they were to maintain that musculature in how you do it, because the thing about GLPs, that's why it's also good. Yeah, it's good to lose weight, but it's also good for people that are gambling addicts, alcoholics, drug addicts, because it affects you neurologically to the effect that to the point to where you don't want to do anything. You don't drink, you don't do, which is a good thing, especially if you're an alcoholic or a problem drinker, because that's going to hurt you too. But
do they have one that's like synthesized just only for that part of the brain?
No, not really. Now we have certain drugs that are not GLPs,
That can do
that
that
are
can
like
help?
naltrexone. We use naltrexone is a agonist antagonist of a narcotic, but it actually works. We utilize it for pain management for patients that are trying to get off taking so many narcotics. We use that, but it works for alcoholics, which is it's quite interesting. Now that and then I have a patient.
Wait, naltrexone works really well for alcoholics?
Yeah, or people that are they're
Does it
addicted
do any?
for
Does it have any
certain-
side effects or negative effects of using
It'll
it?
either work or it won't work. It's not really. They didn't really have any. Now but you have to be careful because if you're taking some type of pain medication, your pain medication is not going to work right because of that's in your system. That's like a reversal. It's like it has like Narcan in it. Is naltrexone. That's what I mean by antagonist. And so you have to be careful with that.
So what would you say like gambling addicts, like you say that like they have a neurological.
There is a serotonin and dopamine release that causes you to be like, I want to do it more. That's what happens in your brain. And so if you can bring that down, especially on certain individuals that just can't stop.
Are there certain people that just get a higher high out of it?
What do you mean a higher high? They don't get, no, it blocks that. It blocks. Yeah,
The people when they're doing the act.
Yeah.
Okay. So
oh, absolutely.
Gambling addict who's obsessed with gambling, for some reason, when I'll go and I'll get a tiny little bump, they'll go and they just get a huge. Like, is it how their brain is?
Yeah, it's just how their
toward?
brain's wired, and that's why it's tough for them. They destroy their lives, or
I don't
destroy their
understand.
families.
Like, how do you get wired? Someone get wired?
It's all about
brain chemistry.
Yeah,
right?
it's all about brain chemistry, and everybody's different. Everybody is different. And that's something that we want these quantum computers that will be supposedly as fast, if not faster, than the human brain, and we don't even know what the human. It can do a lot, but we haven't even. It can do probably so much more. We just don't know how to tap into those. And certain people have. That's why you have these people that are, super athletes or like super geniuses. They can tap into it. But the average person
We'll just die using 10% of our brain.
Yeah, exactly. That's very interesting about those particular peptides and how they affect your brain chemistry. And they do cause you to not have that kind of dopamine or serotonin release where you enjoy it, and so you choose not to do it, which is a good thing if it's a bad thing, but it also, there's people that take them and they don't want to work out.
Right.
And yeah, they're losing weight, but they're also losing muscle, and it's, you need to work out. Nothing is a one pill does it all. It's a quick fix. It may seem like it's great the first few times or the first few months that you're taking it, but everything has a little bill collector in it, and then it's going to come asking you to pay up eventually. So you have to be careful with that. Hey, if you like this episode, hit us on our link, subscribe to our podcast. We talked about peptides. We talked about GLPs. We talked about how can we make GLPs better with essential amino acids. We talked about the future of medicine. A lot of these kind of touch upon things that are very important to you, or at least they should be important to you. If there's other things you want us to talk about, please hit us up, send us any questions, and follow us on all social platforms.